Midwest Ear Institute is the center of excellence for the complete care of ear, hearing, and balance problems in children and adults.
Hi, I'm Patty Spitler. You might remember me when you were a small child watching Wish TV.
Patty Spitler is an Emmy Award-winning television news anchor, broadcast journalist, and entertainment reporter from Indianapolis, Indiana. In her 32 years in broadcasting, Patty anchored the noon news on weekdays, reported on location, and traveled to Los Angeles or New York nearly every weekend to interview celebrities from stage and screen. Patty was diagnosed with Meniere's disease in 1987. Meniere's disease is an abnormality of the inner ear which causes vertigo or severe dizziness, fluctuating hearing loss, tinnitus, and the sensation of pressure or fullness in the ear. Patty has been a patient at Midwest Ear Institute for over 15 years, receiving treatment from Dr. George Hicks and audiologist Lisa Busald to manage her Meniere's disease.
My first experience with Meniere's disease, and at that time I didn't know what it was, I felt dizzy and fell down at work. I went to 3 separate doctors between 1987 and 1991 on to 92. I was recommended to come to a friend of mine said, why don't you try Dr. George Hicks? He's a good guy.
Patty's most significant need was to get her balance problems under control because they were interfering with her day in and day out activities, professionally and privately.
Getting the dizziness under control took several years, and Dr. Hicks performed several medical procedures to get that dizziness under control.
Patty's hearing, which was not good in the left ear when she first arrived, the problem started to develop that she started having hearing decrease in her better hearing right ear.
I didn't want to tell anybody because I was in a job where you have to hear it right the first time. You can't say, they can't say, when you would do breaking news, 3 people are dead and you go, what?
That's the need to be there when someone has a problem and understand what they're going through, especially when you have someone who depends a great deal on communication for their job.
You need compassion, yet you need also experience and someone who is educated to say, here are your options, and here's what you can do, and here's what you can expect to happen next.
Going into more detail with them, helping to guide them and to probe into what they have to say. This is critical.
I found Midwest Ear Institute and Dr. Hicks to give me the things that I needed to cope with my growing problem, which became a job-specific disability in my case.
There may not be a medicine or a surgical correction of their hearing loss. So we have to discuss with them the use of hearing instruments and how they can benefit them in improving their ability to hear and understand.
And then as her hearing loss deteriorated and she became a candidate for a hearing instrument.
You must take advantage of the technology that's available. And you can only do that if it's done correctly by people who are experienced, have the background and the training and the understanding of what these instruments can do.
The relationship I establish with my patients is very important to me. It's very rewarding that through the use of hearing instruments we're able to improve their quality of life.
You need to go to a professional that will take the time to diagnose what sounds you are missing.
The combination of the physician input and the audiologist input is critical in doing it correctly. So the proper hearing instrument can be matched to the particular type of hearing decrease we're dealing with.
That is what Midwest Ear Institute will do for you. That's what a professional will do for you, and Dr. Hicks did for me, is to, because everybody is different. You can't just buy, one size does not fit all.
And the nice thing about present-day technology is if there is a change in the hearing of a person who has hearing instruments, you reprogram the hearing instrument to fit whatever change has occurred.
I still have Meniere's disease. It is progressive and permanent. It is not a disease that you can cure. Through Midwest Ear Institute and Dr. Hicks and their staff, I have learned, and they have helped me manage it.
people come in the door with one set of concerns or problems, or more than one, and hopefully after a certain amount of time, sometimes quickly, sometimes it takes a while, there's a positive outcome. They're better.
I'm better now in that I accept it, I'm working with it, I have a positive attitude, and that helps a lot too. And that's what comes from having a good doctor as well. Hearing instruments have made a huge impact on my quality of life.
And that's the rewarding part of our particular specialty.
The technology, the professionalism of the doctor, the courtesy of the staff, they all work together to help you. That's what they should do. If you're not getting that, you're not going to the right place. Midwest Ear Institute, the Center of Excellence for the complete care of ear, hearing, and balance problems in children and adults. For more information about our professional staff and services, hearing instrument treatment options, or assistive listening devices, please visit our website at www.midwestear.com.